This is Tucson, or Tucson as it was renamed. This is the ancestral lands of the Tohono Nation and the Pasquayaqui tribe. As many things have changed over time with colonization, attempts to assimilate and purge natives, there is still a rich culture here full of tradition and pride. Tucson is really about community. Here at Tucson Indian Center, we've been around for over 60 years providing services to the urban Native community. My name is Dylan Baisa, and I am a member of the Choctaw Nation of Oklahoma. I serve as the Social Services Director here at Tucson Indian Center. Our data ecosystem is called the PIMA project. PIMA is actually an acronym standing for Promoting Indigenous Models of Assessment. And that's really the cornerstone of our approach here, is trying to connect with the Indigenous community. While we've been doing this work for a long time and been stewarding the data for the community here, historically, there's been a lot of issues with collection of data on Native American people. We have established our Community Advisory Councils of about 10 tribal members from various different tribes represented in the urban space here in Tucson to provide guidance, steering, and direction. Looking at how things like fair pay, job security, access to health care, ceremony, traditional healing, or even culturally respectful workplaces affect the community's ability to work, stay healthy, and feel supported through it all.
Go up to a high plank.
If they don't have the benefit of a data ecosystem, then people fall through the cracks. The data ecosystem closes the gaps in our disparities. We get to have our voice now amongst all the other voices. The funding, we get to have the people, we get to have the answers we didn't have. That is necessary for us to have that Indigenous value system, Indigenous ways of knowing, our Indigenous ways of doing.
Oftentimes when we'll do a smudging ceremony to try to cleanse or get rid of any negative energy or negative spirits that may be around. Similarly, with our data ecosystem work, we're trying to cleanse and purge that Western colonial perspective, considering research as ceremony, and try to build something that's really rooted in Indigenous thoughts and mindsets.
My great-grandmother was a well-known basket weaver, and in her baskets is data, it's stories. In our dresses we wear, there's meanings to these colors. There's meanings to everything we wear. The shells are our strength. This is our strength. This is data. All these little markings all mean something.
We really want to return to a time when Native tribes were the stewards of their own data and use that data to really help ensure that their people thrive in all areas. We're here at Mission Gardens. This is actually an ancient agricultural site. It's been continuously farmed for the past 4,000 years. These gardens allow us to take a look back in time and try to imagine a system or ways of doing things before Western influence and dominant systems.
People, they want the help and they want the change, but it's hard for them to take action because of obstacles.
Some of the work that we're really proud that we've accomplished is the creation of a centralized intake form to try to help reduce barriers to our clients who are seeking services.
The more people we get, the more we can get done. It just takes a lot of cooperation and understanding and participation.
The biggest challenge that I've faced has been around not having enough members to having too many members now, which is great.
She actually was able to put together a data workshop at the Tucson Museum of Art and have people attend the full workshop all day and listen to the speakers and what they had to say about Indigenous data sovereignty. She's done a really great job building the council that we currently have.
And another great thing we're doing in year 2 with this PIMA project is we're finally being able to connect our advisory council with our government partners at Pima County Health Department, bringing together the different elements so that we're working as more a unified team behind this health equity goal.
Sky's the limit, just like this feather. This was on an eagle that was way up in the sky. Follow your dreams, because I never thought I'd be getting this opportunity, and look at me.
I want members of the community to know that they don't need to be data experts or data specialists to become part of the solution of what we're trying to do with this PIMA project. Their lived experiences, their values, and their perspectives are all things that are so helpful to this project and can really help us elevate that status for our community here.